Many of the great forces on Earth are generated from above, and it is to the sun that humanity has looked for thousands of years as a source of energy, as an object of worship, and as a means of timing their lives. The sun produces various kinds of rays, including heat rays, visible light, and invisible ultraviolet light. It is the invisible ultraviolet, or UV light, that can cause damage that can result in melanoma and other skin cancers.
Melanoma is a kind of cancer that starts in black moles in the skin. It's the most aggressive and difficult of the skin cancers. It's also the most rapidly increasing cancer in the United States. The danger of melanoma is that even when it's relatively small, it can send off cells that can attach in the lymph nodes or travel to other parts of the body, such as the lungs or the brain or the liver. And once that tumor spreads, it becomes very difficult to treat. There are a variety of kinds of treatments, and whenever there are many treatments, it means that none of them really work extremely well. Chemotherapy tends not to be very effective in this disease, although there are some patients with very aggressive combination chemotherapy regimens that can have good regression. But it's in this area that forms of immunotherapy, that is, stimulation of the body's immune system, have really come to the forefront. And very recently, interleukin-2 as an immune stimulator was approved by the Food and Drug Administration for the treatment of patients with metastatic melanoma. And we've been working on the development of cancer vaccines, that is, ways to immunize the body's immune system so that the body itself can reject the cancer.
Between 65 to 85% of cancers can be prevented through diet and lifestyle changes, and more cancers can be successfully treated if they are detected early.
The best thing for cancer, period, is early diagnosis and, of course, prevention before the diagnosis. That's why we're very excited about these kinds of programs where we can tell people, especially with skin cancer, if you can limit your sunlight exposure, you can really increase your chances that you will not develop a skin cancer as an adult.
Regular self-examinations help to detect skin cancer at its earliest and most treatable stages. Limit sun exposure. If you enjoy basking in the sun's warm glow, try it before 10 a.m. or after 4 p.m. Be sure to apply sunscreen 30 minutes before venturing out and wear a hat. Bear in mind that healthy, golden glow is a sign of skin damage that can result in melanoma and other skin cancers. And remember, if you want your skin to look like leather, keep tanning your hide.